afternoon, and thanks for joining us. I'm Judy Simpson. An estimated 13,000 Vermonters are now diagnosed with Alzheimer's disease, and that number is expected to increase by 30% in the next 8 years. For patients and their families, a dementia diagnosis leads to questions and concerns. So today, we're going to focus on Alzheimer's awareness and brain health. Joining me are two guests, Dr. Michael LaMantia, as head of the geriatric medicine at UVM Medical Center and is the director of the University Center on Aging. And Dr. Walter Gundel is a respected, now retired cardiologist. He started as a volunteer with the Alzheimer's Association several years ago, and he now serves on the association's board of directors. Thanks so much for coming in.
Thank you so much.
So what has made each of you so interested in the issues of Alzheimer's and dementia?
Well, I'm a geriatrician. I take care of older adults, and this is one of the more common issues that older adults have to think about and face as they age. I got into the field of geriatrics because when I was a first-year medical student, I had two grandparents who were living in nursing homes. And unfortunately, Alzheimer's disease and dementia are the things that most commonly affect persons who live in nursing homes.
Mm-hmm. And how about for you, Walter?
Well, I had, over the course of practice in medicine, several patients who had a compelling story and presentation with their own experience with evolving dementia. Made me sensitized to this particular disease entity, which has been stigmatized and basically over a long time neglected. And when I became a volunteer and was linked up with some marvelous people who are oriented toward caregiving and education and support, and linked me with a lot of old medical colleagues, it was a perfect fit for me, coupled with an appreciation, as Mike will be pointing out, the dimensions that you also mentioned in your introduction. Mm-hmm. The dimensions of the dementia problem were also very compelling. So. Very motivating factors for me.
Is dementia the same as Alzheimer's disease?
Well, we have to remember that dementia is an umbrella term. And underneath that umbrella is Alzheimer's disease. So all Alzheimer's disease is dementia, but not all dementia is Alzheimer's disease. When you look at dementias, about 60 to 80% of them are caused by Alzheimer's disease, but there are other causes beyond Alzheimer's disease. You could have a vascular dementia, you could have a frontotemporal dementia, you could have a Lewy body dementia, but Alzheimer's disease makes up the largest chunk of that.
And so what do we know about the causes of Alzheimer's disease?
Do you want to take this,
Well,
Walt?
We don't know any specific cause, such as a virus or a bacterium, but we do know that there are a constellation of risk factors that help to predispose people to developing Alzheimer's and other forms of dementia. First and foremost is simply age. It is much more common as we grow older. If we live to be 85, our chances of having dementia beyond that point are 1 in 3. So it becomes increasingly frequent as we age. We do know that women have a little bit higher incidence, primarily because they live longer than men on the average. The presence of a strong family history increases your risks, as does recurrent concussive brain injuries, which we've become very sensitized to.
Right.
Traumatic encephalopathy is the name for it. People with Down syndrome have a much higher risk of developing Alzheimer's. And we're now becoming aware that the conventional risk factors for vascular disease, especially cigarette smoking, high cholesterol, uncontrolled diabetes, hypertension, these factors also contribute to some extent in enhancing and increasing the risk for developing dementia.
And so I know, Mike, you brought a prop with you that sort of explains some of what we're talking about. Maybe you can show us what we're talking about. We have a brain.
Yes.
It's not meatloaf.
And so we have a brain here, and the brain sits in your head like this. Mm-hmm. And what you have going on when you look under the microscope in Alzheimer's disease is you have the development of plaques and tangles throughout the brain. And depending on the person, these plaques and tangles may be focused in one area or another at first. And this tends to affect people's presentations, we think. We can also see that there are parts of the brain that are coordinating centers for memory. There's a center of the brain called the hippocampus. And we can see in people with Alzheimer's disease that those hippocampi, that's the plural of hippocampus, that they shrink over time.
Okay.
And so what that is thought to cause is a problem with the laying down of new memories and the consolidation of new memories. This is thought to go and cause what oftentimes people, caregivers and loved ones of persons with dementia will notice is that, yeah, my mom, she can remember what happened 50 years ago, right? But she'll have problems remembering what happened last week or last night.
Right.
It's because they're able to retrieve the memories which have already been laid down. But the hippocampus is thought to be playing a role with moving memories potentially over from short-term into long-term.
Interesting. That makes perfect sense. Now, how do you know if you may be suffering from dementia or you're just short of memory or just, you know, I've misplaced my keys? Right.
So it's a matter of degree and it's a matter of frequency. We all have what some of my patients like to call senior moments that come up where we walk into a room and we forget what it was that we were looking for. Sometimes those are a factor of how stressed we are, how anxious we are, how many things we're trying to juggle in our day. But if we start to see that an isolated thing becomes a pattern, that's when it's time to have a conversation with your primary care doctor around this. When we look at these types of numbers of persons who are affected by the disease and who are going to be affected by the disease, we need to, I think, work as a health system and as a state with the perspective of how do we make access to care scalable. And what we know that we have in this state is primary care doctors around the state. And hopefully we can get everyone connected up, particularly as we age, with someone who you can call your primary care doctor. And that, I think, is the first place to stop when you have questions about your memory.
And Walter, when should you do that, do you think?
Well, the important thing from a standpoint for Michael and me is that anybody who is developing significant cognitive change needs a prompt medical diagnosis. In the past, there's been a kind of a shrugging, why bother, what can we do about it? Well, in some instances, we can actually do something very definitive. Roughly 8 to 10% of people who present with an important cognitive change have a curable basis, such as severe depression, vitamin deficiency, a drug reaction, a benign brain tumor, a condition known as normal pressure hydrocephalus. My wife thought I was losing it until I got my hearing aids, because I couldn't hear some of the things she said to me. So it's very important to have a prompt medical evaluation to assess for the possibility of something that is treatable, but also to get an early start on identifying your care providers, your support system, such things as advanced directives and medical or legal considerations if you are developing some form of dementia.
Make a plan.
So, get a plan going, exactly.
One of my, if I can jump in with an anecdote here, of one of my most successful cases of Alzheimer's disease that I treated when I was working at another hospital. I was called as a geriatrician by the bedside to come and see this gentleman who they thought had Alzheimer's disease. And I discovered soon after coming by to see him that not only was he deaf, and needed to have headphones put on in a amplification device put in front of him, but we also needed a translator because he didn't speak English.
Oh my goodness.
And once we got the amplification device and the translator, the gentleman understood perfectly what was going on with him. That was a nice case of Alzheimer's disease that we saved with a little bit of technology.
Now, if there's a strong family history of Alzheimer's, should a person undergo genetic testing, do you think?
Well, so when I take a look at families who have Alzheimer's disease that runs within them, I tend to get most concerned about families where Alzheimer's disease occurs at a younger age.
Right.
So that's people who start developing Alzheimer's disease before the age of 60. That's the cases where we think that the genetic testing can be most helpful. Yes, there's the case that Alzheimer's disease runs within families, and people may come in and say, you know, my mom had it and my grandmother had it. It's really difficult with the genetic testing that we have to disentangle how much of this is due to genes and how much of it is to that you have a shared same environment as your mother and your grandmother had, meaning that you had the same lifestyle, you ate the same foods, you had the same proclivity towards exercise or not, right? And so I really am not recommending it to persons unless they are seeing that it's developing on the younger age of the spectrum. And then it's a complicated decision. Whenever someone gets genetic testing done, you're not just having the testing done for yourself. It's frequently uncovering whether or not other family members also have a risk for it. And they have a say in that.
Right.
They may be affected by those results just the same way that you're affected by those results.
Is there anything that we can do, people at home, folks watching this, to put off Alzheimer's, to not necessarily prevent it, but are there some things we should be doing?
That's a great question.
It is, and I'm sure Mike will add to whatever I say about this, but there are many choices and lifestyle considerations that contribute to brain health. And that's something I think we are going to be emphasizing a lot more. Such things as regular aerobic exercise, a very healthy diet that is sparse in terms of saturated fats, rich in plant and nuts and other healthy ingredients, good, stable social connections that are a vital part of your day-to-day life.
I'll jump in.
Jump in, Mike.
And I'll say that beyond staying social, we want you to manage your stress. If you're feeling depressed or anxious, talk about it with your provider so that you can come up with a plan to address that. Make sure that you get adequate sleep. What do we talk about as being the appropriate amount of sleep for an older adult? Somewhere probably between 6 to 8 hours of sleep. We want to make sure, just like you're exercising your body, that you exercise your brain. There is some emerging evidence that keeping your brain active may be associated with preventing cognitive changes. And so I'd say do 30 minutes of brain exercises a day. What does that mean? It doesn't mean that you have to buy a product off the internet that costs you $300. Spend $3 buying a crossword book. Spend $3 buying the Sudoku. Do the crossword or the word jumble in the paper, but keep that brain active. And then you want to make sure also that you stay in contact with your primary care doctor.
Right. You said first stop is a primary care doctor and talk about it.
Right.
All right. Well, to contact the Vermont chapter of Alzheimer's Association, you can check the website. It's right there on your screen. It is alz.org/Vermont. You can also call the association toll free. That number is 800-272-3900. I want to thank you both for coming on and talking about this. And once again, in 30 seconds, the number one thing you should do if you suspect Alzheimer's in yourself or a loved one.
The first step for you is to make an appointment with your loved one's primary care doctor. Stop in and talk about that. That's how we get this condition out of the shadows.
Excellent. Thank you both for joining me today.
Thank you so much.
Thank you very much, Judy.
That's our program for today. I'm Judy Simpson. I'll see you again next time on Across the Fence.